Hello everyone, I'm Hassan Patel, final year Mbbs from Vadodara, Gujarat. In this video lecture, we're going to study about corrosive poison. So before we start, I want you all to recall what we have studied in our first video lecture. In our first video lecture, we have classified poison in a various category and groups. One was corrosive poison. We have classified corrosive poison in three groups. First was acid, another one was alkali, and third one was metallic salt. We have further classified acid into inorganic and organic. Inorganic acid, also known as mineral acids. Example are sulfuric, nitric, hydrochloric acid. If we're talking about exam point of view, mostly questions are asked from acids, and specifically that is sulfuric acid, nitric acid, carbolic acid, and oxalic acid. These four acids are very important. So when you are reading your textbook, please put a mark on these acids. So let's dive into the topic and understand what is corrosive and what are the corrosive poison. So first question comes in our mind. So what does the word mean? What does it define? So corrosive means a substance that destroy, fixes, and erode the surface with which it comes in contact with. So whenever this acid comes with a contact with tissue, it causes its corrosion and goes inside the tissue. So word corrosion, it's a Latin word that means to gnaw. Gnaw means to bite into or go into. So this poison go inside. That is what the corrosive means. So if any question is asked from any chapter of toxicology, any poison, how are we going to write in exam? There are some headings we must make a note on to secure maximum marks. So we are talking about any acid. First thing we should write is about its characteristic. What is its odor, physical state, is it liquid, gas, then its odor, properties, everything comes in a characteristic. Then signs and symptoms. Signs and symptoms will be classified in like first will be acute signs and symptoms, another one will be chronic. Fatal dose, cause of death, complication, treatment. As we are going to be a doctor, we must be thorough through the treatment, and postmortem changes. External and internal. When body comes to us at our autopsy, when we have to perform the autopsy, the things which we look at the first will come under our first external changes. Then we dive into when we open the body cavity, we look for the internal changes. So before we go through the sulfuric acid, I want you all to understand the difference between the acid poisoning and the alkali poisoning. There are some difference, very important difference. When acid come in contact with tissue, it causes the coagulative necrosis, because there is the heat formation, heat generation, that causes the coagulation of the protein, and there is the formation of the scab or ischar. So because of this ischar or a scab, it prevents the further penetration of the acid into the tissue. So as a result, the lateral spread of the acid is restricted. Because of the scab, it prevents this further penetration of the acid. As a result, there is the restricted lateral spread, and the injury will be superficial. So once the acid come in contact with the tissue, there will be the scab formation or ischar formation. As a result, the acid won't be penetrating inside the tissue. That's why the injury will be superficial. In case of the alkali, it causes the liquefactive necrosis. There is the absence of the ischar formation. As a result, there is the high lateral spread tendency, and the injury will be very severe. This is very important from Viva perspective. Examiner asks the difference between acid and alkali poisoning. This is the ischar formation or the scab. As a result, the lateral spread is restricted. Now we're going to understand the mechanism of action, how the corrosive works, how there is the formation of the scab. So when acid or corrosive come in contact with any body part, any tissue, it causes the extraction of the water, and as a water extracted and react with the acid, there is the heat formation. This heat formation coagulate the protein and precipitate, and it also converts the hemoglobin into hematine, and there is the formation of the scab and the corrosion and destruction of the tissue. So sulfuric acid characteristic, as we understand, like when we have to write about the answer about any poisoning, first comes is a characteristic. So sulfuric acid is also known as the oil of vitriol, battery acid, or oleum. It's a heavy, odorless, colorless, and non-fuming. So when we open the bottle of sulfuric acid, there won't be any fumes, but in case of nitric acid, there will be fume formation. So it has a tendency to carbonize organic substance. So when sulfuric acid comes with the contact with organic substance, it will cause its carbonize and it will get charred. Substance will become black. It's a hygroscopic and has higher affinity for water, and it will have tremendous heat when it mixes with it. So where the sulfuric acid are used, sulfuric acid, as we have said, is also known as battery acid. So it is used in the industry chemicals, storage batteries, accumulators, also the pipe and drain cleaners, and laboratories. And fatal dose is around 10 to 15 ml. Just 10 to 15 ml of sulfuric acid can cause death, and fatal period is 12 to 24 hours. Now clinical features. If someone consume sulfuric acid for suicide, usually corrosive acid are not used for a homicide perspective, because it is not coming in a category of ideal homicidal poisoning. So it's usually the cases are of accidental or suicidal cases are seen. So what are the signs and symptoms, and what are the clinical features? So there will be corrosion of the mucous membrane from mouth, throat, esophagus if someone try to ingest it. There will be epigastric pain all over the abdomen and thorax, and pharyngeal pain. The teeth will become chalky white. When come in contact with teeth, it will become chalky and white. Tongue will become swollen, black, and abdomen will be distended and very tender. If you just touch, it will have a severe pain, and eyes will be shrunken and pupil will be dilated. So these are the clinical features. Now let me show you how a chalky white teeth looks like. If you look at this teeth, unfortunately we don't have the color image. If you have a color image, the teeth will become chalky and white, and tongue and surface which it come contact with will become swollen and black. And one more thing, there will be white streaks at the angle of mouth. If someone try to ingest the corrosive poison, it will start to ooze out from the angle of mouth, and there will be white streaks. GI symptoms, there will be all GI symptoms, and there will be also respiratory symptoms, because when acid is ingested, it will cause the inflammatory edema flatis and pharynx that will cause the suffocation and death. And complication will be circulatory collapse, edema of ascites, collapse due to perforation of the stomach, toxemia. And one more thing, this poisoning case, it is not affecting CNS. Mind will be clear till the death. Person will be knowing what he is going through, what he signs and symptoms he is having, all thing he will be suffering. So mind will be clear till the death. Now if family comes to us with a patient that Dr. Sahab, my son or a daughter consume this acid to commit suicide, but the dose was very less, but now they rush to hospital, and as a doctor, what we are supposed to do? How are we going to treat this patient? Question arises. So treatment will be, we activated charcoal, and gastric lavage is contraindicated. Why? Because stomach become very paperish tendency. It can cause the perforation. So if we try to do gastric lavage, there is high tendency to have gastric perforation, chemical peritonitis, even shock and death. So it is contraindicated. So what we can do, we can dilute the acid immediately with the in situ by 1/4 of the water or milk of magnesia or lime, aluminum hydroxide gel, and within 30 minutes if we give aluminum hydroxide, it is effective. Alkaline carbonate and bicarbonate are contraindicated. Please make a note. Now if a dead body comes to us at the autopsy for autopsy, so what are the postmortem changes, what are the autopsy findings? So we have to look for the external signs and the internal sign. So corrosion will have the first, it will have burns. It will cause superficial burns just in contact, and within 30 seconds it will cause the deep burns. So evidence of the acid corrosion and chemical burns within the brownish black parchment like uncorroded spot are seen over the chin, neck and chest resulting from the trickling of the acid. So acid will trickle out, and it will have one more note, it will have white streak from angle of mouth. There will be excoriation of the lips, mucosa of the mouth and tongue will become swollen and black, and teeth will be chalky white. We look for the internal findings. When we open the body, we look for our upper GI tract, lower GI tract and respiratory system. What we observe first we observe that the stomach is more involved and more damaged compared to esophagus. Why? Because esophagus has squamous epithelium, and which is relatively resistant compared to columnar epithelium of the stomach. So mucous membrane of esophagus, it is inflamed, swollen, edematous, severe intestinal hemorrhage. So lower GI, it is more affected, stomach is more affected. But make a note when you write in your examination, esophagus is relatively resistant compared to stomach. Greater part of stomach is converted into soft, boggy, black mass. Make a note, and it will have the papery feel, very papery feel, and it will disintegrate, and that's why gastric lavage is contraindicated and it can cause chemical peritonitis. So this is the thing, stomach is more affected compared to esophagus because of the epithelium difference. Small intestine also shows the evidence of irritation, and larynx and trachea is severely inflamed. Look over here, stomach, it is readily disintegrated, wet, blotting paper consistency, and perforation can cause acid into peritoneal cavity and chemical peritonitis. Let me show you more picture of the stomach, how it looks like from inside. You can see over here it is charred and very paperish tendency. And now medico-legal aspect. Accidental poisoning can occur because it can be mistaken for the glycerin or castor oil. It is seen in the suicide case are comparatively more seen than homicidal. Rarely we find homicidal case because it does not fall under characteristic of ideal homicidal poisoning, and it can sometimes can be used as the abortification drug and vitriolage. In next video lecture we are going to learn about vitriolage or acid throwing in very much detail, and including the new BNS, Bharatiya Nyaya Samhita. Earlier it was IPC, now it is changed. We will include that as well in our next video lecture about vitriolage. Now let's come to our next acid. We're done with the sulfuric acid. We learn about characteristic, its fatal dose, its signs and symptoms, treatment, and what are the autopsy finding, internal, external. Now we come to the next important nitric acid, that is nitric acid. Mostly signs and symptoms and everything is same like nitric acid and sulfuric acid. There are few changes. So nitric acid, also known as the aqua fortis or spirit of nitrate, it is a colorless and fuming heavy liquid. Sulfuric acid was non-fuming, this is colorless and fuming. So in concentrated form, it combines with the organic matter and produces the yellowish discoloration. That is xanthropic reaction. Xanthroprotic reaction. When nitric acid come in contact with tissue, it will oxidize it and it will be the formation of yellowish discoloration, xanthroprotic reaction. So this is HNO3 and this is colorless fuming. Look over here, you can see it's a fuming acid. So most important, whenever the question is asked, signs and symptoms, everything is going to be same. Treatment is also same, but only one thing that is different is about the when it come in contact with organic tissue, it causes the xanthrotropic reaction and causes the yellowish discoloration. Fatal dose is only 10 to 15 ml and period is 12 to 24 hours. Mode of action, it is a powerful oxidizing agent, react with the organic matter and produce the yellowish discoloration. So most important, xanthoprotic reaction, write it down in your examination, and most signs and symptoms, everything will be the same. And you can see over here, this is our yellowish discoloration of the nitric acid poisoning. And corrosion will be comparatively less compared to sulfuric acid, because sulfuric acid is hygroscopic acid and causes more extraction of water compared to nitric acid. And clinical feature, everything is same, but corroded area will appear yellowish because of this xanthoprotic reaction. And most severe excruciating abdominal distension due to the gas formation, and perforation of GI tract is less common comparatively sulfuric acid. So with this we complete our mineral acid in, and hydrochloric acid is also same, signs and symptoms, everything will be same, treatment is also same. So with this we conclude our mineral acid. In next video lecture we are going to learn the medico-legal aspect, vitriolage. Thank you so much, stay curious, keep learning, have a nice day.